Hello.
We are good to go.
Alrighty. My name is Jamie Rose. I'll be your virtual family council coordinator. At this time, we're going to review our confidentiality statement. Please refrain from using the name of your loved one. Do not name any specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you're in, and we'll get you connected with your assigned ombudsman. And these calls have public access and are designed for family members and friends of long-term care facilities. Now we'll review our agenda. We're going to get our virtual meeting tips from Kim, and then we're going to have a presentation from Tara Gaudin on building resilience through Reliance, resistance, and rest. That's a lot of R's. And then we're going to get our Department of Human Services guidance review from Kim, and then we'll discuss some pretty exciting upcoming meeting topics with you. So I'll turn it over to Kim for your virtual meeting tips.
Hi, everybody. Welcome. So we're going to just quickly review our virtual meeting tips. Most of you at this point are used to using our Zoom platform, but there may be some folks who are new to the group. You have all been placed on mute when you've entered the room, and we're going to open the lines in a bit when we would like you to share with us. So if you would like to speak or add to the conversation, we recommend that you use the raise hand feature, or to chat or use the chat box, so to speak, to put in messages. If you hover your mouse near the bottom of your screen, if you're on a computer, you'll be able to see the participants tab. If you click on that little icon that looks like people, you can actually see all the people that are in the meeting. And at this moment, we have about 53 people with folks still joining our meeting. Also, beside that, you can see a little box that looks like a thought bubble, and that's your chat. When you click on the chat, you can choose to chat with all participants, everyone in the room, or just individual people that are on that list. And you can also turn off your microphone by clicking on the little icon that looks like a microphone, so you can use that to mute and unmute yourself. If you are unable to do that, using that raise hand feature will help us to get you unmuted. We will not be using a poll question tonight because we really want to make sure that we have time for the content that we have prepared for you, and also for Tara's presentation. If you need to step away for any reason at all and you want to stop sharing your camera, you can click on the little icon that looks like a movie camera, and that'll turn off your camera, and then you just click on it again to turn it back on. Any concerns or complaints that you have specific to your loved one, or an individual concern that you have, you may direct those to the State Ombudsman Office at the phone number you see on your screen, which is 717-783-8975. And if you are techie and you want to email us, you can email us at ltc-ombudsman@pa.gov. Jay Rotz, who is on the call tonight to start us off, is our administrative assistant in the State Long-Term Care Ombudsman Office. And Jay will take your call or answer your email and get you connected to the person who can best assist you. So Jay, thank you for joining us. Jay also is the master of our email list. So many of you are receiving correspondence from Jay every week. We did remember, Jamie texted me this morning sometime in her travels to let me know that she remembered at the last minute that we promised we were going to be sending out reminder emails to folks along with the link, because there was some issues with folks getting that link week to week. So we did that today. So thank you, Jay, for taking care of all that for us and keeping us straight on who's who and what's what. So with any further ado, I'm going to turn things back to Jamie, and we are going to, I think, move right on over to Tara.
Alrighty. I would like to introduce Tara Gaudin. She is the Director of Montgomery County Department of Health and Human Services, and she is going to share a wonderful PowerPoint with us at this time. So thank you so much for joining us, Tara.
Let me get off of mute. All right, we're good. And I think I am sharing my screen. And I think here we go. All right, well, hello, everyone. Hopefully you can see the screen. And I'm just so super excited to be able to talk with you all. I know this is some very, very difficult times, and we all are going through some really, really stressful, challenging times. And I was happy that I was given the gift to be able to bring some words of inspiration, motivation, however I can do to help kind of keep us going through each and every day. So I'm excited. One of the thing I want to talk about this evening is building resilience through reliance, resistance, and rest. Before we go into that, though, I do want to say that I am going to get some help with my Bitmoji here. I don't know if you can see that on the screen. My Bitmoji is, I'm obsessed with Bitmojis, and I'm obsessed with kind of these animation things. So I decided to use one to kind of help me with tonight. So you'll see her throughout the presentation. So I want to start by asking you to think about who, what, or where keeps you going, right? So who keeps you going? What keeps you going? Where keeps you going? What keeps you moving forward? And what keeps you pressing on? All right, so kind of if you think about those things, right? So who, what, or where keeps you going, keeps you moving forward, and keeps you pressing on, right? So that's what resilience is, right? Resilience is that thing, that inward thing, that outward thing, those people, we're going to talk about it way, way more a little bit later, that keeps us going, right? So I always like to start with, if I am sharing my screen, it looks, okay, here we go. What is resilience? So just start with the basics. So resilience is the capacity to recover quickly from difficulties. Resilience is toughness, the ability of a substance or object to spring back into shape, elasticity, right? The ability of a substance or person, I will say person, to return to its usual shape after being bent, stretched, or pressed. The capacity to prepare for disruptions, recover from shocks and stresses, and adapt and grow from a disruptive experience. So resilience is flexibility, pliability, suppleness, again, being able to be elastic, springfulness, durability, ability to last. Resilience is strength, sturdiness, toughness, hardiness, adaptability, buoyancy, again, the ability to bounce back and bounce back ability, right? So resilience is incredibly important, right? It's incredibly important and is incredibly powerful. And I would say during this times, and we're going to talk about what this times mean, right? So it's an array of difficulty, right, that we're all experiencing before the pandemic, before the social unrest that we're experiencing, many of us, before even a personal struggles, difficulties, challenges with our families, with ourselves, with our loved ones, right? That resilience gives us that ability to last through it, right? So I talked about some of the stressors. So when we talk about the stressors, I love this PowerPoint that I got from the National Council for Behavioral Health, right? It talks about what are the stressors. When we say that we're going through specific times, you know, there's so many jokes about 2020 being incredibly difficult, right? Now we all can't wait till 2021, right? So these are some extraordinary times. It's sometimes it sounds like a cliche, but it's very true. These are unprecedented times, right? So some of the stressors that we're all feeling are because of the pandemic, right? The need to social or physically distance. And that comes in the form of many, many things, right? Many of us are working from home. If we are working, many of us have not been able to see, touch, feel our loved ones, our friends, things that we did normally to connect and engage physically. We can't do those things, right? We have worries about our job, right? If we do have a job, how has our duties changed, right? How have they had to be adjusted? Some of us have lost our jobs, right? Which causes financial constraints. Anticipation about the future. So how long will this time, right? About where we talk about the pandemic, we don't have a real, confidence in when will this end, right? So there's stress around that, right? And a lack of control over that, right? Constant doom and gloom, right? And, that's not being facetious. There's constantly, we wake up and there's the stressors of what we're doing today, how we're going to get through the day, right? Social media is telling us things. The news is telling us things, right? Some of us are working all the time. I found myself, even though I'm working from home, I had to set boundaries of saying, okay, I'm in my living room. My living room is an office right now. Now it has to turn into a living room, right? I have to cut work off, right? Many of us are having chronic health problems, right? So not only worried about the COVID-19, but we still are in our bodies. Our bodies are still reacting to not only what's going on out in the world, but just our normal wear and tear, right? So sometimes we have chronic issues that develop, or they have already been there, and we're trying to deal with them, right? Merging the roles and constant multitasking, right? So, I always feel for the parents where they have little ones that they are expected. If the little ones are being schooled at home, you're now a teacher, right? So you're a mom, a dad, a guardian, a grandmother, grandfather, cousin, sister, brother, and now you're also a teacher, right? So how do we manage all that? How do we manage and help our children build their own coping mechanisms, right? The social unrest, right? So we're in this very, today was voting day, right? So, this is a huge election. Every election is important. This is a huge one. So kind of the anxiety that can come with that, right? We have our racial unrest, right? We have our civil unrest, right? We have protests. We have, there's feelings of being unsafe, right, with everyone, not only with when we talk about racial unrest, like Black people feeling unsafe, people who are protesting, those, just this feeling of being unsafe, right? And then finally, with all this, we have noticed that there has been an increase in substance use, isolation, definitely when we talk about the social distancing, and loneliness that comes in this time of, again, not just a pandemic, but just where we are in the world today, right? That, before the pandemic, there was loneliness, isolation, and that has been exacerbated. And then also, this is not on here, but this is a cycle of life, right? Where many of us have experienced loved ones passing, right, who have died. So not only in my workplace, we've had a number of deaths this year, and personally, we may have experienced death. And then as a nation or world, we had deaths that really had impacted all of us, right? So we were in some very, very, very stressful times. So again, resilience is that ability to bounce back, right? To be strong, right? To be able to strengthen ourselves in times of a lot of stress, difficult times, right? So one of the things that I want to say about building resilience is that there are these building blocks that I discovered that, not only in my personal life, but in kind of talking to different people. There's really 3 categories. There's a bunch of other stuff, but I want to focus on the 3 that I think are so powerful. And the first building block to resilience, again, to be able to bounce back and to really be strong during difficult times, is a reliance on others, right? So during tough times, even when nothing seems to work right in our lives, and you only have one leg to stand on, right? It's much easier to stand on even that one leg if you have support. So even if the other people, we're all kind of sometimes standing on one leg. So even if the other person in your life is standing on one leg or tipping backwards themselves, we can still support one another, right? No one has to have it all together in order to be supportive to someone else, right? In order for us to feel that support too. So support can be lots of things, right? Emotional support when we're going through a hard time can be as simple as someone who really listens to us without judgment, right? Without trying to give advice, someone who's just listening, right? Someone not trying to fix us, but they're just listening. Practical support can be someone who watches our children when we have to apply for a job or interview, for example, or go shopping. Support could be someone who is just calling and checking in on you, right? Who's just texting you, see how you're doing, right? How you're coping, if you need anything, right? Support is having someone cheer you on simply because you made it through another day, right? That's what support is. And I love this. My little Bitmoji has her squad, right? That's the squad. So just think about who in your life gives you the energy, that helps you believe in yourself, that encourages you to pursue your goals, whether it be big, giant goals that you would still want to pursue, or tiny, small goals, right, that we have moment to moment. Who are those people in your life? And I love to call them, they're your resiliency squad, right? So just think about who are those people, because you may already have them, and then maybe you want to expand, or maybe you want to start a squad, a resiliency squad yourself, right? All right, so the second one is there's two reliances. One on your reliance on others. The other is a reliance on our values. So our personal values shape our experience in the world, right? What research has shown is that when we are consciously connected with our most important, our most heartfelt values, that is what can buffer us from psychological stress. So literally, conscious awareness of our values can stop our brain from producing overwhelming amounts of what we, the cortisol. We've heard this about stress, right? That's the hormone which, when produced under pressure, stops us from able to really think clearly, right? So not only able to think clearly, but to function clearly, right? So when we choose to make decisions and do things which align with our highest priority values, we are more likely to do them willingly. And guess what? When we align our behaviors with our values, then we have a sense of satisfaction, and we can even experience happiness. So even during difficult times, when we're walking our values, we're talking our values, we're living our values out, we're saying, this is the course of my values and I'm going to live those out, we're able to experience joy and happiness even in the toughest times, right? So when our behavior and our hearts and our minds and our bodies are aligned with our core values, then we find great personal power and we're able to build resilience. So an example of this is, before the pandemic, I was really into exercising, right? And I love the aerobics, like the dancey stuff, right? I would do it every day. I would give myself a sticker on the calendar when I completed it. I was just proud. I was feeling good and all that stuff, right? The pandemic hit and I was just like, what the heck? I just stopped all of that, right? I stopped kind of all movement of my body just to, to be able to cope. But I realized I was so unhappy. And one of the reasons, there's a lot of reasons why we can really struggle through the pandemic. We talked about it. But for me, that value of being able to move my body and treat my body well in that way, I wasn't living that out. So I was very, very unhappy about that piece. So when I was able to identify, Tara, get your body back moving, really make your body feel good doing that, and I was able to push myself through, it made me feel so much better, right? It made me feel like I was living out my value, that I was taking care of myself even in the midst of all these difficult times. So that's an example of building resilience through reliance on your values, living those out.
Tara, just a deep breath here. I'm the chat moderator. I'm Jeannie, and there's a couple of comments. One is mine, that I'd love to have the slide of the resiliency squad. I don't know if you're going to give that.
Yes!
And Carol Deepapaw says that she was giving herself stickers as well during this time.
Yes!
CM says you're right on, Tara. So we're all cheering out here.
Thank you. You all have now become my squad. Thank you for that. I love it. I love that encouragement. I'm so happy to hear that. Stickers, I'm a believer in that self-encouragement, those goals. So wonderful. I love it. And I would absolutely love, please, you can definitely have this PowerPoint, use it as you will. My Bitmoji, I would love her to go all around the world. So please. Excellent. So thank you for sharing that. So the second building block is building resilience through resistance, right? So resistance, what does that mean? So when I say resist, so before we start, this is a real quick, just again, these are, because we have so many people on, which is fantastic. So I'm going to ask you to answer this just for yourself. So I'm going to go through some real questions. So this is, are you stressed? So that's the kind of a hint of when I say building a resilience through resistance, what this means. But I'm just going to ask you to answer these questions for yourself. So do minor problems and disappointments upset you excessively? Right? Do the small pleasures of life fail to satisfy you? Are you unable to stop thinking about your worries? Do you feel inadequate or suffer from self-doubt? Are you constantly tired? Do you experience flashes of anger over situations which did not bother you before? Have you noticed a change in sleeping or eating patterns? And then do you suffer from chronic pain, headaches, or backaches? So these are, if you haven't, guessed it, these are kind of signs that we're stressed. And again, before we experience anything of what we're experiencing now, we absolutely could have experienced stress. It's a guarantee, right? We all are stressed. We all have experienced stress, right? But this is just, I wanted us to kind of reconnect with what stress is and how it can come and show up in our lives. And sometimes we're in such constant stress that we forget that we're stressed, right? But these are kind of bring us back to the base of this is what stress feels and looks like, right? So we know that stress is a natural part of life, everyday responsibilities, obligations, and pressures that really change and challenge us. And of course, there's so many physical and mental responses to stress. Some of them are good, which can kind of compel us to meet a goal that can give us energy. And some of us are really detrimental to our health, right? So we can have high blood pressure. We can trigger behavior that we don't like the overeating or the oversleeping or not sleeping enough, right? So too much stress can cause like insomnia, backache, so much goes on. So it's so important to manage our stress, right? So I do want to go, oh, did you hear that? I don't know if you heard this sigh, but that's really about how we reduce or manage our stress. We want to get to a point where we're just exhaling, being able to move and to be able to breathe in a way that is not so stressful. We want to be good to ourselves. So again, we're talking about building resilience through resistance. And this resistance is resistance to stress, right? So that's what I want to talk about. So just some quick pointers about how to reduce or manage your stress. I want to say this. Many of us have been very, very good with being able to cope with stress, to manage our stress. We have coping mechanisms. Some of these things I'm going to quickly go through, you've already done. And so I ask that you think about those things that you are doing to manage your stress and really celebrate that. Keep going, right? If there's some things that you put to the side, because we got to this really ultimate, pressure cooker that we're in, I ask you to bring those things back, right? Breathe life back into those things. And if there's anything on this list that's new to you, I ask you to, kind of challenge yourself to another challenge, but, kind of pick one of these things and say, let me try this to see if it works, right? So real quickly, I just, one of the most important things I talk to people about managing your stress, because I don't want managing the stress to be stressful, right? So just be realistic and flexible with yourself. Ask yourself on a day-to-day, when you have tasks and things to do, ask yourself what really needs to be done. How much can I do? Is this deadline realistic? What adjustments can I make? Do I need help, right? Do I need help? Remember, we talked about our resilience squad. Is there someone who in my squad can help me with this, right? Of course, we always talk about meditating, practicing mindfulness, breathing. I love the breathing, just taking some time to consciously take a deep breath in and then out just for a few seconds, right? Just concentrating on our breathing. That's one of the easiest, most accessible ways to de-stress. It's just to be thinking of your breathing and just taking deep breaths. Mindfulness is being present in the moment, right? Enjoying feeling the moment, right? Not letting things pass. It's beyond just kind of taking time to smell the roses. It's actually just stopping for a moment and just experiencing the moment, right? That also helps with stress. And then meditation, there's a variety of things you can do to meditate, whether it be a guided meditation or just a simply, I'm just going to stop for a minute and just quiet myself, right? The other thing is visualize, imagining and picturing yourself being able to handle a stressful situation, right? Whether it's getting information about your loved one, whether it's getting information for yourself, but visualizing if this is going to be a stressful interaction, how can I make it not as stressful? What kind of things do I need to say? I rehearse things all the time in my mind. I put the scenario in my mind. I have characters, but when I finally get into that situation, I'm able to handle it better because I kind of already did it, right? So the next one is take one day or one task at a time. The positive feeling of checking off a list, again, being realistic and flexible, but also the satisfaction, right? you know, those going back to those stickers on the calendar, right? All right, I got it through this day. Tomorrow we're going to get through that day, right? Move your body. I always say, you know, it's important. I'd love to dance. I had a dance party right in my living room on Friday night. I wish I could show you. I had the disco ball for Amazon.com. I had the streamers. I just went in, right? So, but I couldn't go to a real disco, right? I couldn't go to so I created it at home, but it got my body moving, right? So however you want to do that, you know, that's important to de-stress. Make health your wealth, your nutrition. I'm not a nutritionist, and people tell me all the time I still struggle with that, but I know that when we make good food choices, right, it helps with our stress, right? Start or restart a hobby. We talked about bingo. There was a statewide bingo. I love that. That's so fantastic. And to be able to do it virtually, I think it's genius. So those things, playing games, you know, my mom loves puzzles, anything, kind of, you know, to go back into that, right? Share your feelings with others. Stay in touch with family and friends as best as you can, right? We're all trying to do our best to stay connected, but it's so important. And one of the things that I really want to emphasize is to go easy with self-criticism, right? Remember, you are human. And that means you are not perfect. Remember, we all make mistakes. We all have shortcomings. We don't know everything. We don't see everything. We can't do everything, and we can't be everywhere at once, right? So those are some tips. Okay, and actually I want to save this one. This will be part of the PowerPoint, but I thought we're coming this time where there's a lot of holidays. We have holidays all year round, but that can be even more stressful. We say that holidays are very, very stressful, and these are some points, and you can read them when you get the PowerPoint. But just know that we're not only in a pandemic, we have some political unrest, we have everyday life, but now we're going into the holidays and we don't even know how the holidays are going to look, right? So the Thanksgiving, I had my brother-in-law say, okay, we're all going to do a Zoom Thanksgiving and we're just going to, you know, make food and eat it on you know, video. And that didn't go, you know, really well with some people. And some people were like, yay, and others are like, no. But we got to think about that. How do we celebrate holidays in the midst of, like, the social distancing and all of that, right? All right. My final one is building resilience through rest. Now, when I say rest, sleep is very, very important, right? We have to get our sleep. But for me, resilience through rest is more than just making sure we get our sleep and making sure that we're aware when we're feeling that we have insomnia, because that's also something that we can do, we can feel during stress, but that we make sure that we get our rest, our sleep. But really rest, I love this quote. It says, resilience is based on compassion for ourselves as well as compassion for our others, right? So it's really about having compassion for yourself. Self-care. And I love this. I saw this, and if I don't know if you all remember, but in the very beginning of us having to be in quarantine and isolated, they used to say, if you don't come out of this quarantine with a new skill, your side hustle started, more knowledge, then you never lack time. You actually lack discipline, right? So that was the big thing, right? It's like, okay, now you don't have an excuse, right? You have all this time in the world, you can get stuff done, right? But finally, I love when someone said, wait a minute. If you're not doing any of that stuff, you're doing just fine, right? Because we are going through a collective traumatic experience. Not everyone has the privilege of turning a pandemic into something fun or productive, for heaven's sakes, right? Please just stay healthy, right? I saw that on Facebook and I was like, I'm stealing it. That's exactly right. We had all these standards and it's like, no, darn it, we're going through a traumatic experience, right? You don't have to have all these goals. It's okay not to be okay, right? So that's being good to yourself. That's having self-care, right? The other thing is, what I find about self-care, what's so important, is that we have our own personal Sabbaths, right? And it's not a religious thing. It could be for you, it could be, but it's really a Sabbath is a time of intentional, planned time of rest, right? It's a time of personal restoration. It's during this time of rest that you can replenish or receive back the things that we've given to others, right? Having a specific time of rest and restoration of your mind, your body, your spirit is incredibly important for our overall health. And it's one of the most powerful cornerstones for building our resilience, right? So I ask you just to make time in your day, your week, when you won't be distracted, and it can be just, could be hard to do, but try to find a moment where it's just for you, right? you know, some things you can do is you can pray, you can write, you can journal, you can dance, you can sing, listen to music, just go out and observe nature. You can make something, fix something with your hands, just you decide. But be willing to sacrifice to find this time regularly as you can, and to try to make it a habit, because the reward is so well worth it, right? And so some of the things, you know, I ask you again, think of some times of rest and restoration that you've experienced in your life, and how can you incorporate them again now? So if you put some things off your plate or off your to-do list of making sure you're taking care of yourself, can you bring some of those things back, right? So think about what relaxing activities that you currently enjoy. Can you increase those, right? What are some physical pleasures that make you feel good about yourself, right? So things that you've noticed that make you feel good, can you increase them, right? What are some places that you can go that help you get in touch with yourself? I know that near my apartment complex, there's this little park that I can just walk around, and it's getting colder, but you know, that's what I did during the spring. You know, I just made time to walk. What kind of things will you do for your personal Sabbath, right? So that's my little assignment, is to think about what you can put in place now to be your personal Sabbath, right? So again, I want to encourage you that resilience is our ability to bounce back, to be strong, even in the midst of difficult times. And you got this, right? You are here today, November 3rd, 2020. It is 5:03. You're still with us. You are strong. You are powerful. You are resilient, and you're going to continue to build your resilience, right? So again, just remember to rely on others, rely on your values, right? Resist stress, manage your stress, acknowledge your stress, and then learn ways and do things that are going to manage that, reduce it, and then remember to rest during this time, however that looks like for you, to be able to take the time aside and take care of yourself, to be good to yourself is so, so incredibly important. So, but thank you all so, so, so very much. And I hope this was helpful. I hope this was helpful. And I definitely will share the PowerPoint. And I want to close with one last thought. On the other side of a storm is the strength that comes from having navigated through it. Raise your sail and begin. All right. Thank you.
Tara, you've got an awful lot of chat here. Everybody's saying thank you, thank you.
Oh, you're so welcome. You're so welcome. My pleasure, my pleasure, my pleasure.
All right, Tara. Thank you so much. You did such a wonderful job, and people are just blowing up the chat here with all kinds of positive affirmations for you. Someone said something here that I just have to share with you because I felt it and I wanted you to hear it. Let's see if I can find it. Tara, you are the bomb we need right now.
Oh,
thank you so much for this presentation.
Oh, thank you.
You know, just know that this group of people, it's waxed and waned a little bit as we began. We began, oh my gosh, all the way back in late April, early May meeting. But what you bring to us is hope. This group has really dealt with some heavy stuff. They've, you know, got their loved ones in long-term care. They are dealing with a daily fight to get their visitation back, to see the people that they love. And so you brought to us some hope that we need to take care of ourselves in order to make that happen. So I just want to say thank you. These folks are all about to get to hear me talk about some of the visitation restrictions and reopening plans for where their loved ones live. And so you put them in a great frame of mind before I move to this particular topic, which is not nearly as positive and upbeat. But I do want to give folks an opportunity, if they wish, to personally share anything with you before we move to that. So is there anybody who would like to say anything to Tara, or
Bonnie Allen says, I have tears in my eyes, Tara. Happy tears that we are not in this alone.
That's right. That's right. That is, we're not, you're not, we're in this together. God, now I'm cheering up. I'm so, we are not in this alone. We are absolutely not. Yep. That's right. Yeah.
I think one of the things that a lot of people have felt throughout this whole thing is that they have to fight those urges that we all have to take the rest we need. I don't think when we first entered into this process, we ever thought that it was going to be this long.
That's right.
And now we're facing the end of the year is coming and we're still fighting this uphill battle. So
That's right.
I love your idea of having a squad. And
yes.
I'm officially naming this the Virtual Family Squad moving forward because it's a very different, we're in a different place now. We've gone from angry to, we still have anger, but we're moving through those processes, and I feel like we are becoming a squad now of people who all have the same ideals, the same values. We want this to happen. So
that's right.
Yeah.
That's right. That's right. Go on with your aligning with your values, and that's right. That's it. And this is right. This body. Now you guys got me excited, right? I was, but that's right, right? This. You're a support. You're your circle of support. You have these values. You want to find strength with each other, and you know what I mean. And having that accountability of saying, are you taking care of yourself? Right. I love that. Right. This is fantastic, Kim. So fantastic. Yep.
So I'm just really pleased that folks were able to. We have a new ombudsman, and she just said, Tara, I'm a new ombudsman. Your words moved me. We all need to stick together to be a team through this process. So yeah, it is. It's, and whether we've been here, 30 years or 5, we're all in a different space and a different place, but that doesn't mean that our feelings aren't very much the same. So yeah, it's a rough go. But I think there's a lot we can do to get through it. There really is.
That's right. Right.
Nice.
Well, thank you. Thank you so much. And anything you need, just let me know. I will definitely send the PowerPoint, so please share it. People can feel free to definitely reach out to me. What I'll do is I'll put my info on the PowerPoint too, just so people can have it. I love to talk, and I love to, again, I've adopted you all part of my squad seriously now. So thank you. Yep.
Good. Right. All right. Well, you're welcome to stay on if you want and listen to all the other stuff.
I will.
If not, you can feel free to jump, but thank you so much for your time tonight. All right. Okay. So I'm going to go ahead, folks, and just move through some of this guidance. I'm very cognizant of time. I don't want to keep you way past, because I know some of you are going to want to be perhaps watching some television tonight or listening to something. I understand there's some really big thing happening in our country right now that may or may not be causing some of you some additional stress and anxiety, but it's okay. We know it's election night, and you all chose to go ahead and meet tonight, so I appreciate your due diligence in making us part of your night. So we're not going to keep you too long, but I do want to review a little bit of this Department of Human Service guidance, because it is different from the guidance that came out from the Department of Health. And so I'm going to start out first by just sharing some definitions. So one of the things that Department of Human Services does at the beginning of their guidance is identify for you what a new facility onset means for COVID-19. And that refers to COVID-19 cases that originated within the facility. So when they say that they have a new onset of COVID-19, they're talking about cases that have happened within the building, okay? Please note, though, it does not encompass, they do not call a new onset if someone comes back from the hospital and they're COVID positive. So as you know, some folks have gone out to the hospital, they've recovered, but they bring that COVID-19 positive diagnosis with them back to the facility. That doesn't count as a new outbreak in that facility or a new onset of the disease. So they also won't count that if they come back from another setting and COVID happens within 14 days of that person coming back. So just so you know that. Here's what they're calling an outbreak on the Department of Human Service side, and this will apply to all your personal care homes and assisted living facilities. An outbreak is defined as a staff person, volunteer, or compassionate caregiver that tests positive for COVID-19 and was present in the facility during the infectious period. The infectious period is either 48 hours prior to the onset of symptoms or 48 hours prior to the positive test of an asymptomatic person. Okay, so those are definitions that we've seen all along, but I think it's really helpful to just keep those in mind as we move through the rest of this guidance. In the Department of Human Services guidance, they do still recognize a compassionate care and compassionate caregiver. So I want to share those definitions as well. Compassionate care refers to caregiver access necessitated to maintain a resident's health and well-being based on a documented significant change identified in the care or support plan. And compassionate caregiver is a spouse, partner, family member, friend, volunteer, or other individual identified by the resident's family, or facility staff to provide the resident compassionate care. So there are still 3 steps of open in personal care and assisted living. In step 1, a facility must meet all the prerequisites that are defined. They need to be without a new outbreak of COVID-19 for 14 days. Visitors are still restricted during this period except for compassionate care and compassionate caregivers. And a facility can move to step 2 after 14 days in this phase with no outbreak. So what does step 2 look like? After their 14 days of COVID-free in step 1, they can begin outdoor visitation if weather permits. If weather does not permit, then indoor visitation is allowed, but there's still not crossover visitation. If 14 days COVID-free in step 2, the facility can then move forward to step 3. In step 3, they're going to have to be 14 days in step 2 with no new outbreak. Indoor visitation is permitted at this stage. Crossover visitation is also permitted if there is no new outbreak in the other facility. And when they're referring to crossover visitation, they're talking about your continuing care retirement community type setting where you have nursing facility folks and personal care homes all on the same campus. So they can crossover visit in this step 3, okay? So they're allowed to move about freely on campus as long as there's no new outbreak in either facility type. So some points to remember about this. The facility must provide for virtual visitation when all other forms are prohibited. The facility should consider the community positivity rates in all decisions about indoor visitation in step 2 and step 3. So you all know what I'm talking about when I say the community positivity rates. And unfortunately, we are all beginning to see an uptick in our community positivity rates across the state. And when that occurs, that enters into the decision-making process for facilities as to whether or not these visits can occur. Facilities should not restrict visitation unless there is reasonable clinical or safety concerns. So that's really important language, right? We want to make sure that you all know that they can't just restrict visitation to restrict it. There has to be a reasonable clinical reason or a safety reason to do that. So what are the facility's responsibilities in this level of care for visitation? Well, they've got to establish and enforce a visitation plan, and it must be posted for families to access. They have to establish visitation hours, and they need to designate a specific visitation space in a neutral zone in the facility. And they need to establish spaces that allow for social distancing. So it's got to be in a neutral zone, and it has to allow for social distancing for indoor visitation.
Couple of questions, Kim.
Sure.
Donna Lance is asking, will there be a copy of this? And also, can a facility require family members to get tested before visiting?
I'm going to get to that because testing is part of my presentation, but the answer is yes. And we'll talk about when that applies. So yes, we'll get a copy of this out to everybody, and this is also being recorded for the Facebook. We're going to upload that to Facebook tomorrow. So you'll have a couple of different ways to access the presentation afterwards.
Okay.
Anything else, Jeannie?
Yeah, Laura Perryman says her mom's facility is still not allowing compassionate visits or caregiver visitations, meaning we can only see her on Zoom one time a week, and if lucky, I'm sorry, I don't know what the abbreviation is, DORS, WJBFIE, visit with no touch. Apparently no one can make a facility give compassionate visits no matter the outcome.
Okay. We'll talk about that a little bit.
Okay. Paige has said that she has allowed compassionate care visits with her father, and what does that mean exactly?
Okay.
And finally, iPhone is asking, can they limit virtual visits due to staffing?
So one of the things that it does absolutely require as the prerequisites is that they have adequate staffing in place to manage both the scheduling and coordination of visitation and also any support that's required. So that is definitely required on the facility's part. They cannot limit virtual visits due to staffing necessarily. They're supposed to be encouraging that. So I'd be curious whether there's a new staffing problem. So is it that there's a new COVID outbreak in the facility and that's what's impacting staffing? And compassionate care visits, I'm gonna get to, I think, in a minute, what is all encompassed in those visits. So here are what the responsibilities of the visitors are. So if you are granted compassionate care visits, or if you are granted regular visitation because the facility is now stepped through to step 3 and they're allowing indoor visits, you must wear a face covering with the universal masking requirements in facilities. You need to use hand sanitizer that's alcohol-based. It should be in the facility and available to you both before and after your visit. You need to stay in the designated visit locations. So when they establish the neutral zones, that's where they want you to stay. You need to sign in and provide contact information in case someone has exposed you or there is a new outbreak. They want to be able to contact trace and get in touch with you if they need to. And you have to adhere to the screening protocols, such as answering the questions about whether you've been exposed and possibly even testing. So let's talk a minute about testing. So the level of COVID-19 activity in the community surrounding a long-term care facility has a direct impact on the risk of COVID-19 introduction to the facility. So in other words, if COVID is spreading in the community, there's a good chance there could be spread within the facility. Facilities that are experiencing an outbreak will begin testing immediately and move back to restricted visitation. So they will go back to the beginning if they have a new outbreak of COVID-19. And they'll begin the process again of working toward 14 days through step 1, step 2, and step 3. Compassionate caregivers, so if you do receive the compassionate caregiver designation, that means that your loved one has had a significant change in conditions, and the support plan is giving you permission, basically, or indicating that that compassionate care is warranted, then you will need to provide proof of a COVID-19 negative test. And it will have to have been administered with a result within the last 7 days, preferably 72 hours if testing results allow. But we all know that the turnaround times in your area at your testing sites will dictate how quickly that will happen. So if there's community spread, there's a good possibility that they will require testing for indoor visitation, even in step 3. Compassionate caregivers from step 1 to step 3. The neat thing about being designated as a compassionate caregiver is that it does not matter what step the facility is in. You can still provide compassionate care to your loved one, but you will need to prove that you have a negative test. And testing continues to be the hiccup in some of this for some folks. So what are compassionate caregiver responsibilities? You need to show proof of that negative COVID-19 test. You need to undergo screening of symptoms prior to each visit. You need to social distance from your loved one if possible, but we all know that if you're providing feeding assistance or hygiene assistance, then it's going to be difficult to stay 6 feet away, okay? Visits should be limited according to this new guidance to 2 hours per day, and there can be no more than 2 caregivers per resident per visit. So someone asked, I saw in the chat, about what does the neutral area mean? So the neutral zone is established for indoor visits, and that's an area where there would not be pass-through. So it'll be cleaned, and then your loved one will be brought to the neutral zone, and then you will socially distance and visit there. So that's what the neutral zone is. So there is also guidance in this release about outings and what you can and can't do when it comes to outings with your loved ones. So facilities must or should establish a policy to address safety measures beyond additional testing to safeguard the spread of the virus from residents who leave the facility routinely, which could include but is not limited to outpatient healthcare visits, including dialysis treatment, social visits, day programs, and admissions to another healthcare facility. So outings for medical appointments, here is what is required for those. Residents should continue to receive medical care that's needed outside of the facility. Transportation when provided by other than facility staff should only be granted when there is no known risk of COVID-19 transmission. So in other words, the person that's providing the transport, if I'm taking my mom, I'm going to answer a bunch of screening questions that say, I do not have COVID, I haven't had exposure to anyone with COVID in the last 14 days, etc. All infection control protocols will be followed. That means universal masking in the vehicle, etc. Hand sanitizing or hand washing, and staff will monitor and screen residents upon return to the facility for symptoms of COVID-19. So this does not automatically mean that the person is going to be placed into quarantine because they go out for dialysis, okay? But if there is some concern that there may have been exposure at the dialysis center, the person may isolate during that time because of concern for exposure. So what about non-medical outings? This is the question that a lot of family members have right now. What about taking my mom out? Each facility should establish their policy to include precautions for these types of outings. Note, it does not say they should restrict them. It says there should be a policy, okay? That's important. Here are the considerations as to whether or not visitation for non-medical reasons is a good idea. So they need to consider the extent to which infection control precautions can be achieved on the type of outing the person is going on. So is the person going to a wedding with 150 guests, or is the person going to a family dinner with just their daughter and son-in-law? Okay, there's a difference, obviously, between the amount of risk going to a wedding where there's 153 people versus this. The resident's level of vulnerability. So is this resident in a high-risk category? Do they have pre-existing conditions that could make them very sick from COVID? These are things that the facility is going to consider before granting a person a leave for non-medical reasons. And the duration of the outing, how long is it going to be? Are you just going out for a quick meal at home and coming back, or are you going on the road for a road trip across country to California for a vacation? Because that's a very different risk than just dinner out with your family where you're going to stay masked and interact 6 feet apart. Here is a little caveat about non-medical outings that are considered high risk in the guidance. Any outing where there is substantial community spread of greater than 10%. So I've heard a real variance and range out there right now, anywhere between 5 and 7. Our numbers are kind of creeping up across the state. So right now, pretty much any outing where there's more than 10% would be slim to none, although there are some places where we are seeing some spikes. A gathering of 10 or more people. So if you're going to have 25 people over, they're going to question whether or not that's a safe outing, okay? Failure of consistent universal masking, failure of social distancing, things like hugging or riding in a vehicle with an unmasked person for a great period of time. So these are the kinds of questions and concerns that will be raised about non-medical outings. And I just want to end with the 3 things that we are using as guiding principles as ombudsmen in approaching each and every one of your concerns that you bring to us about these guidances. So while we know that there is a lot of confusion, and it's not just on your part or our part, but on the facility's parts too. This is a lot of stuff they have to keep track of that they never did before. And we know that this can be really confusing, and some places are being very strict and other places not so much. So, you know, we know that there's a lot of variables, right? But for the purposes of our squad, which is the ombudsman world, we're looking at every request that you bring to us about this with these 3 C's in mind: care, compassion, and common sense. So when you bring a concern to us, we're going to take these 3 things into consideration, and we're going to ask questions around these 3 things. Is this best for the person's care? Is it showing compassion to this individual and getting them what they need for their social, emotional well-being and health, as well as their physical health? And is there common sense involved in the decision-making? Okay, so that's how we've been approaching things. And believe me, I know that there's not a right or wrong answer, and there is not a black and white answer to 95% of the things that come to us right now. But it is extremely important that you ask for these things. You know, if you want to be a compassionate caregiver for your loved one, or you want to provide this kind of assistance, or you want to be in there feeling connected to your loved one in some way, if we can help to make that happen with these 3 things in mind and the guidance that's been provided by CMS and the Department of Health on the nursing home side, and by Department of Human Services on the personal care and assisted living side, we will certainly do our darndest to help negotiate that. But, you know, we know that a lot of facilities are very gun shy right now, and they're erring on the side of caution because they're very concerned about an outbreak. And I can appreciate that, but I also know how much, as we said, we're living through this trauma together, right? I know how much trauma this is causing for everyone as well. So hopefully that gives you a little bit of an overview of the key high points of the DHS guidance. Jeannie, I'm ready to take a couple questions here, and I'm also just glancing at the time.
Question from Paige.
Okay.
That she is allowed compassionate care visits with her father. What does this mean exactly? Paige, I think that you will find in the written summary of the information that you get that there's a very good explanation of the compassionate care visit that Kim gave you, so that you'll be able to follow up with that. The thing that you need to ask yourself is, can you meet the responsibilities of the compassionate caregiver for your father and provide the things that he needs? The social distancing, the masking, the screening, and so on.
Yep.
Another question from iPhone, can they limit virtual visits due to staffing? The answer is yes, because staffing is a critical component for the personal care homes and assisted living residences. We have a request to remind about the priority for residents with cognitive impairment.
Yes.
For example, dementia being considered a disability and prioritized for compassionate care. And it says, does that override the care plan due to loneliness?
It should already be part of the support or care plan. So if someone has a dementia or any kind of a cognitive impairment disease, that should be part of the support plan already. And any changes as a result of that, I don't think that they would give you a hard time about that. It would be whether or not the person's had a significant change as defined in the guidance.
We have a question about the neutral area. I think that you also addressed that.
Okay.
But they have a concern that window visits are in a living room where all members of the nursing home can access, and all can hear everything that is said by family and resident, including the staff on the phone. I would take that directly to my ombudsman, my local ombudsman, to ask for privacy of your transactions and conversations.
Yep, absolutely.
Laura Perryman, we're trying to see if we can get non-medical trips just to get mom out home for a couple of hours to each of her kids' homes so she can visit every week. The facility, they said they had to ask their corporate. Laura, on that one, they would definitely be within their purview to quarantine your mother for 14 days every time she came back. So you need to consider that. Consider what Kim said about the number of people involved and limit it to less than 10 to try to have, it seems to me that it would be easier to go to the facility and visit there than it would be to take your mom out for a visit, even if that's what her choice is at this point in time.
Right. And if they do want to try to do that, if they can keep a gathering of any kind to less than 10 people, that still would not be considered high risk. So, less than 10 people, and an assurance that you're going to continue to follow the masking policy, et cetera. Now, obviously, they're not going to send people out with you, but if you can do your best to just mitigate the risk to that individual. They're mostly concerned about the person coming back to the facility and being asymptomatic and potentially spreading it to others. So as Jeannie said, there is a possibility that the facility will ask someone who has taken an outing of that kind to self-isolate for a period of time to ensure that they don't become symptomatic. And you know, I think that's fair, given there are other folks in the facility that they're trying to protect as well.
Also, Kim, I think
Yes.
we have to be aware on our end, on the end of the family,
Yes.
that there are members of our families that are non-maskers and that are not willing to follow the directions.
Yes.
And if you take your loved one out into that situation, it's the possibility of a conflagration.
Yeah. Yep. You are correct.
Lottie Allen asked if the COVID test for the compassionate care family members can be either a rapid test or a nasal swab. I think anything that is available,
Yep.
as long as they can get it within the 7 days.
Yes. And if they can get a rapid test within 72 hours of their visits, that's fine too. Both are accepted.
Donna Lance asks, how can facilities be so strict with families when they have staff coming in and out every day? I think we pretty much addressed that in the past, that they have to rely on their staff. And the second part of her question, are families and compassionate caregivers different roles and responsibilities?
Yes, they are different. So in this guidance for personal care and assisted living, they are distinctly different. Compassionate caregivers are permitted to enter the facility in all phases, where visitors are not. So standard family visitors are not. So you would have some different abilities as a compassionate caregiver. That does not exist in the nursing home guidance. A visitor is a visitor is a visitor there. So that's the difference between the two levels of care and the guidance as it sits right now.
Jan asked, does it still allow the facility to insist on quarantine even if there is no known risk of exposure? We have asymptomatic positives out there, and that's the reason for that, Jan.
Yep.
My neighbor came home from their grandson's wedding in North Carolina. He was asymptomatic positive. She spent 2 weeks in the hospital. There were 10 to 12 people in the wedding party, the family itself, that tested positive after that outing. So there you are. That's why the situation arises and why they can quarantine.
Mm-hmm. Yep.
There's 12 new messages down here.
Oh my goodness.
Yeah,
do we
I'm sorry.
Jeannie, before you go further, let's just see if there's any hands up. I just don't want to skip if Candy has any hands.
Candy? Where are you, Candy? Laura Carrymont has a hand up.
Okay, yeah, Candy was having some sound issues earlier, so she might be frozen.
Laura, can you go ahead?
Oh, hi. I just wanted to respond back to the about the compassionate caregivers. My mom has been on hospice prior to COVID. She's still on hospice. I've asked the administrator numerous times. I've copied my ombudsman, who's been trying to get us in too. We are still not allowed, and we've been not given compassionate caregiver status to our mom. My mom is 82 pounds now. She's lost over 25 pounds since January. She has a pressure sore on her foot now. And there are areas, we try to do a Zoom call once a week. I got a window visit a door window thing, plexiglass visit last Friday. My mom is dementia. She's completely immobile. She does not, you know, she's bedridden, basically. They get her in the chair and she comes out. Her eyes are mostly closed. But on Friday, when my mother came out to that door, they have intercoms on both sides so you can, you know, hear each other. And I was talking to my mother, you know, saying, "Mommy, mommy." Her eye opened up. The other eye was closed shut, which I asked them to, you know, fix that. But her eye, she heard my voice. And to me, that was very emotional for me because I have not been in with my mother for 8 months. I don't even know if she knows me, but that to me was a way that set, you know, I felt she knew it was me. She knew my voice. And I tried to tell her, you know, that I was at the door. She couldn't look over to me or anything, but she kept opening her eyes when I was trying to talk with her and stuff. And, you know, I'm watching my mother decline every time. Our family is watching her. And, you know, I asked today about the bringing her home for a few hours. And my mother's bedridden. She's already quarantined. So to me, that's not the issue. My thing is, and I don't want to bring her home to a big gathering because, you know, we trying to protect her as well and everything. But I had thought, okay, we could bring her home every Sunday for a couple hours to each of her kids' home where only they would be there and, you know, the grandchildren or something that can see her, you know, that she would know she'd be home. So if my mother passes away, when she passes away, I know that she knows we were there with her. And that seems like the only way I'm going to be able to get her out of there so I can be with her and our family, each one. And I'm trying to do the right way, but it's becoming very hard. And I've had so many people, the ombudsman, the senators, I wrote to Department of Health. You know, I'm at my wit's end. We still cannot get in. They just allowed hospice to go in 2 weeks ago. And then I found out, because I thought they would still be going in every week, the hospice nurse. I was told after the fact that somebody made an agreement that the hospice nurse would only come in every other week. Well, in between that, my mother got a heel sore on her foot. And hospice can't go in now until this week. I think it's ridiculous. And something has to be done. I mean, this is so far. I'm sorry. I'm just getting very emotional. And, you know, every time I see my mother and they're declining more, and it's just, you know, I don't know where to turn anymore. I mean, I'm about ready to go in there, pick her up and carry her home myself just because I don't know what else to do, you know? I don't know. And I don't know where else to go, you know, where I feel, and I'm sure various people feel the same way, you know? Where do we go? Where, you know, how do we get this, some kind of, you know, a thing? Because it doesn't matter what these directives say. It doesn't matter because it's what the nursing homes and the corporate says, you know? I give them the copies. They don't care. It's still like, nope, nothing's changed. You still can't come in. You know, why I'm watching my mother and watching nurses and aides sit there and touch my mother that I can't even go in and touch. You know? It's frustrating and it's very emotional. I'm sorry, but I don't know. So if you got any insights, please, I'm willing to hear them, because I mean, I'm even looking at seeing if I can bring her home, you know? You know, I don't have no choice in this. This is not right. And she don't have a choice, and that's not right either. And I'm her advocate. She doesn't talk. She can't speak for herself, you know? We are her advocates. So you can tell me where to go or who to contact, you know, as another step. I'd be happy to listen and, you know, do what I have to do to it. Thanks.
You're welcome, Laura. I feel your pain. I wish I had a magic wand and I could fix these. It is really, it's in some circumstances, it's just such a difficult position to be in. And, you know, I'd like to say that taking somebody home is the answer. The concern there is, are you going to be able to get the care you need at home too? I mean, it's really a tough go right now, even on the home and community-based side. So, not to say that that's not an option, and you know, the facility can help, and we could help you explore that option. There are some resources out there right now, and a lot of it depends on which counties you'd be working with, but you know, we can certainly try to assist you with making some contacts about that if taking your loved ones home is something you're seriously considering. There is one thing here I did see that did pop out at me in the chat, and that was, what is the recourse if a facility is not following the guidelines to allow the visits and outings as it's set forth here? And our best option right now is to go right to the source of the issuing body of the guidance. So if the Department of Human Services issued this guidance and you have a loved one in personal care or assisted living and they're not following this guidance, we recommend that you make a formal complaint to the Department of Health or on the nursing home side for their guidance, or Department of Human Services for the personal care and assisted living homes on the other side. So, you know, we really recommend that you file formal complaints with them. And we can absolutely put the complaint info in the chat. I'm not sure if, I think Jay is gone now, but I'll see if one of our folks can try to get that up in the chat for you, who is also on. Let's see, who's in there?
I have a question
Go
on
ahead,
the
Jeannie.
chat from Gail J. She said, in the facility where my mother resided, they informed me that my mother's designation had to change to do not resuscitate hospice before I could become a compassionate caregiver. Is this true? No.
No. No.
Absolutely not, Gail.
No,
wow.
no one.
I was told, and thank you. This is my first time on the meeting.
Welcome.
So I just want to say thank you to everyone on this call for sharing their experiences, and I'm glad I'm a part of this squad.
Yes.
Because I have support, and I really now understand I'm not alone. So to the lady that was just talking about her mother, I feel your pain, and I know what that is. I don't want to break down, but I'm new to this, and I don't know where to turn. And for someone to tell me that I can't show compassion for my mother because I would have to make that decision destroyed my whole heart, that I would have to change her life. That's hard.
Yes. Yes, it is. And there is nothing in any form of guidance that says that a person needs to have an end of life designation, like a do not resuscitate order or be on hospice in order to receive compassionate care. That is not part of the requirement. They expanded those definitions.
Yeah.
The federal law also expands that definition well beyond end of life. In the beginning of the pandemic, a lot of the facilities were limiting visitation to just compassionate care end of life situations, but that has greatly expanded since the beginning. And yeah, no one should ever tell you that you must change any of those designations. That's up to the resident or the resident's legal representative, but definitely not, thank you, Orion, definitely not they should never dictate that to you. So very important that you do
Thank
that.
you. Thank you so much.
Shirley has posted the information in the chat. Also, there is a comment from Dory Taylor. The members of the group may not know that Dory is one of our regional ombudsman specialists, and that she is also a caregiver, and her mother is in a facility. And Dory says, we talked about bringing mom home, but feel we cannot keep her safe if we bring staff in. And she's talking about home and community-based services there. If we don't know where they have been and we don't have the testing ability, which the long-term care facilities do have, it's a tough decision. But even with the visitation limits, we feel she is safer. Thank you, Dory.
Yep, thanks for sharing, Dory. Yeah, it's, you know, we're in, as our presenter shared with us earlier, Tara said, you know, we're all dealing with trauma right now, and there's no black and white easy answers or solutions to any of these problems. I just encourage you all to try your darndest to think of these things in the same 3C fashion that we are, for every situation that you're faced with, to try to position yourself to think about it from terms of care, compassion, and common sense. And so, you know, there's in between, I did see, and I don't want to not acknowledge this, I did see some positives in the chat this week about folks who have been granted some visitation, and that made me, there was a warm spot in my heart for that this week. I'm glad to see that some folks have had that ability. And I hope that we continue to see that happen. I hope that more and more of you have success in that fashion. It's not an easy go. And I know that you have a lot more questions. We're gonna save the chat. We'll be sure to get, we'll share this PowerPoint. I know folks were asking for it, so we will definitely share that, and also Tara's information tomorrow with everyone via email, and we will post it. I'm gonna send it back to Jamie because, believe it or not, it is almost 6 o'clock. I think we could talk with this squad all night.
Absolutely, Kim.
I don't know that we'd get all the answers, but I'm going to tell you that Mr. Orion here, I don't know if you guys can see him, but my cat has joined the meeting. He thinks that this squad's pretty great. So I'm really grateful to each and every one of you for joining us every week. Oh, Finley's here too.
Thank you so much, Kim.
Yep.
Next slide, please.
You got it.
Thank you, ma'am. These are some of our upcoming meeting topics. Our next meeting, as we are starting our bi-weekly schedule, we'll be in on November 17th with Representative Madeline Dean is going to pop in. And then we are going to hear from, I believe, Carol Scott at the National Consumer Voice and our own Jeannie Urban here to discuss holidays at a distance. Presentation to just kind of give you guys some ideas on what it's going to look like, some creative ideas to still engage your loved ones and experience the holidays. Then we're going to go, I can't believe we're already into December for our first meeting in December. We're going to discuss pandemic fatigue and how that is helping, you know, hindering and, you know, everything about pandemic fatigue and where we're at after, you know, 10 to 11 months of this already. And then for December 15th, we have a lot of calls out for some amazing presentations. So we will announce that once they are confirmed, but we have some really awesome stuff planned for you guys the whole way into January. Some really great presentations. The work group has been really doing a lot behind the scenes. Next slide, Kim. All right, and just a reminder, please log into the Virtual Family Council Facebook page to stay up to date and connected. Since we are going bi-weekly, we are always in there. There's lots of ombudsmen, a lot of other family members are there. Please, you know, if you have any questions, hop on there. Usually one of us is always on there, or you'll get a lot of us, it depends. So, you know, put it out there, you know, come in there, we'll support you. Like Tara said, we're a squad, we're all here together. Usually if it's the nighttime hours, the 1 o'clock, 2 o'clock, that's usually me. I'm the night owl of the group. Early morning, that's more Kim. So we're always here for you. Next slide, Kim. Alrighty, and as always, thank you for joining us this evening. Any specific concerns or complaints, please contact the State Ombudsman Office, 717-783-8975, or you can email us, ltc-ombudsman@pa.gov, or always hop on the Facebook page. We will be providing you with the PowerPoints and any information from this evening, as well as the link to rewatch the video sometime tomorrow morning. So be sure to check your email for that information. Again, thank you everyone for joining us. Thank you, Kim and Tara, for presenting this evening. And we'll see everybody on the 17th. Thank you and have a great evening.
Good night, everyone.
Good night, all.
Good night. Thank you.